Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Maintaining a healthy heart involves more than just a heart checkup. It really does involve lifestyle. We're talking about food choices and exercise. So what can we do to be healthy? We're talking with Dr. Dan Snavely, the Section Chief of Cardiology Services at Valley Health, about this today. Thanks for being here.
Thank you, Melanie.
You're welcome. Lifestyle changes, they're kind of tough, but it's something in our control. So what should we be working for to be heart healthy?
I'm really glad you brought this topic up because it's very important. It's simple. It just takes some willpower and some effort and some planning to do. But that's the biggest way we can impact our health, not just heart health, but our health overall. But specifically for heart health, stop smoking. That's a lifestyle intervention. What I have found is patients have to, one, have the desire to do it, and two, plan to do it. Just randomly coming up with the idea, I'm going to stop smoking. And I have some people that just will literally put them down and be done. But many people, I will say, set a date, remove all of the smoking and smoking paraphernalia from your house, from your car, from your place of work. And this is truly impacting your life, your quality and quantity of life. So smoking cessation is the most important. Dietary modification. It really depends what your inclination is, okay? People have success with many different ways of doing this. In general, if you ask me what, quote, diet is the most heart healthy, I would have to say the Mediterranean diet, which is fruits and vegetables, lean protein. Fish. So this is the overall, I would say, the most healthy, heart healthy lifestyle. Any form, I hate to even use the term diet, however, because this truly should be a modification of how you live. It should not just a time period. It should not be a short fad. It should be, this is how I'm living. Meaning, if you're inclined to be a vegetarian, which many people in our area are not, but if you are, that's a very heart healthy lifestyle. But still have to get your source of protein. Eggs are not bad, okay? We tend to think that you can't eat eggs. Eggs are actually very important source of protein. Doesn't mean you have to always eat the egg yellow with each, but you don't have to throw eggs out the door. But a lean protein, vegetables, fruit, a well-balanced diet, and exercise. And by exercise, again, I mean a brisk walk, 30 minutes, 5 days a week.
Not just a stroll, but you're moving. You're
not just
quickly.
looking at your neighbor's landscape or their house or having a casual conversation, but walk with purpose to where your heart can feel it. I tell people, feel that you're taxing yourself a little bit and then push a little bit beyond that. If it feels too much, then back down. But you have to start with the first step. And every patient I see in the office, almost literally every patient can do some form of aerobic activity. If they can't walk, but they can use isometric exercises with the hands or pump their feet, start doing something. Move is the most important thing.
Yeah, and that can protect your heart. Let's talk about stress management, because that is huge for so many people. How can that play a huge part?
I would say exercise is an important part of stress management. Going to bed at a pre-specified time each night. I know it's very hard when you have children, when you have a family, when you have a job, but going to bed at a pre-specified time, getting up, getting your 8 hours of sleep is very important. We're a sleep-deprived society. Sleep helps tremendously with dealing with stress. Again, I said exercise, healthy lifestyle intent, meditation, prayer. Yoga is a very good form of stress reduction. So dealing with the stress in a healthy way impacts your health and your overall sense of being.
So medication, intervention can take you so far, but lifestyle is also a very important part of heart health.
It's as important as the bypass surgery that you may or may not need, the stent that you may or may not need, or the medications. It's something that you can take control of in your life.
And hopefully prevent you from getting to those other things.
Absolutely.
Yeah. All right, Dr. Snavely, thank you so much. Some great things for us to all get motivated and start doing. Thank you.
Thank you, Melanie.
Thanks for checking in with Monday Health Minutes.